Now, we've been talking about quarantining here. Nurse Alice is with us right now to talk about the protocols of quarantine. Nurse Alice, can you break it down? What does it mean?
Well, one thing I want to just also reiterate is that I'm hearing the word quarantine, and we tell people to quarantine when they have come in contact with someone who's had COVID-19, unsure if they have it, and want to see if they're going to develop symptoms. The president and the first lady have COVID-19, so they should be isolating. So there's a very distinct difference between quarantining and isolating. And when someone has been tested positive for COVID-19, they need to isolate themselves. We need to do tracers to see who they've been in contact with. And because it takes anywhere from 2 to 14 days to test positive for COVID-19 if you've been around someone. And so once someone's tested positive, they need to be at least 10 days out and then also present with no symptoms, no temperature, with no Tylenol, and then that's when they can come off of isolation. But we're just getting started here. So I think it's really important to first say, because the president and the first lady have COVID-19, they need to isolate. So I want the American public to understand the word isolation is different from quarantining. This is a very serious disease. We in the hospital, we wear N95s, we wear gowns. We're doing so much to protect the general public. And it's really heartbreaking to see people so cavalier and not taking the proper precautions and spreading this disease.
Nurse Alice, you bring up an excellent point about isolation, and thank you for clarifying that for us. Let's talk about the president's age. He's 74. He's in the age of concern. When it comes to isolation, what does that change for a man of his age?
So the president is 74, so his age puts him at higher risk for developing complication. The president also has other pre-existing health conditions. He has atherosclerosis. He takes medication such as, he takes cholesterol medication, he takes baby aspirins. So he has a heart disease. As well, we know that his lifestyle doesn't really include exercise and eating healthy. So all of those things together, coupled with a cavalier attitude of not taking proper precautions, puts the president at really high risk for developing complications, and serious ones at that.
Nurse Alice, would you expect Joe Biden and really anybody who was at that debate in that hall on Tuesday to now quarantine or isolate depending on their circumstances?
Right. So those who've been in contact with the president definitely need to quarantine. If they've not tested positive, doesn't matter. You need to take the proper precautions and quarantine, which means restricting and limiting your movement and, limiting your exposure to other people because you don't want to further infect other people. And it can take anywhere from 2 to 14 days to test positive for COVID-19, which is why we want you to quarantine. And especially if you start to develop symptoms such as cough, shortness of breath, fever, those type of things, we absolutely want you to stay at home, stay away from others, and take care of yourself at home. And if your symptoms get really, really bad, we do want you to go to the emergency room and get proper treatment because you may need to be admitted because this is a disease that significantly impacts your respiratory and your airway. So you can quickly deteriorate and have problems with breathing. That's one thing we don't want people to experience at home.
Nurse Alice, I know you were listening before, and we talked about the fact that we know that Hope Hicks had been showing symptoms. Is there a window of time whether we could see the president and first lady displaying symptoms at all? The word from the White House doctor right now is that they're going to continue to work hard from inside of the White House. What does showing symptoms then mean in terms of a window and a period once you test positive?
Right. So when you've tested positive, we ask people, when did you last come in contact with someone who had COVID-19 or you thought had COVID-19? And that's really when your clock starts. So anywhere from that contact to 14 days out is the period of time in which we're closely watching you to see if you develop symptoms. Again, that cough, shortness of breath, sometimes it can present as GI symptoms, fever. We're looking at 14 days after that contact with that possible suspect. So it sounds like we know when the president was exposed. So we really need to take the next 14 days, isolate completely. And then again, once you start to develop symptoms, that's really where you absolutely are even more contagious. Because we know that over 2/3 of people have asymptomatic COVID-19. And so once you develop symptoms, you're actually even more contagious than someone who's asymptomatic.
All right, Nurse Alice, thank you for that.